Good morning. Vaidyo Narayana Hari. A very happy Doctor's Day to all the doctors out there who have been compassionate and committed to provide the service for the humanity. On behalf of Vydehi Institute of Medical Sciences and Research Center, today we are coming live with a very special session for spreading the awareness about the health and welfare. Good morning everyone. I'm Dr. Aditi God. I'm the host for today's session, and we are very privileged to have with us Dr. Rama Mishra, professor in the Department of Internal Medicine. He'll be taking up all your health-related questions and will be giving his valuable insights. So let's begin the celebration with celebrating and spreading the awareness about the health and welfare.
Happy Doctor's Day to all the doctors sitting out there, and happy Doctor's Day to you too, Dr. Aditi.
Thank you, sir. Thank you so much.
And on this day, I should say that behind all the successful doctors, there are millions and millions of faithful, trusting patients who are behind these doctors.
That's true, sir. That's true. So I will request all my viewers, you can join us by directly calling us on the number given below or dropping your health-related question in the live chat box. And sir will try to give all the possible answers. But make sure that you tell your name, your age, and the place from where you're joining us today. Before we start and the viewers join us, I would like to ask few questions to sir as well. Sir, like morning you've come, and Bangalore, it's like quite polluted nowadays. Major reason is definitely the traffic jam. So what are the things which we can do to protect our lung health?
I thought I will not face this question first thing in the morning. I left very early, but even after that, I faced a significant jam even at this time. So I don't think there is any escape from jam or pollution given the urbanization that we are living with. However, what best we can do for our lung health, it's as always exercise. It could be respiratory exercises, it could be general exercises, but yes, when you ask especially about the lung, there are a lot of respiratory exercises which improve the strength of the respiratory muscles.
Okay.
At the same time improves your lung quality and all that. You can see celebrities talking about air filters, but that's not for everyone. People who can have air filters.
The common people cannot be just like sitting in the air filter whole the day. Definitely.
So I would suggest, say, wear simple masks. It could be a construction worker, or it could be auto drivers, it could be anyone.
Or we stuck in traffic jam.
Anyone.
Definitely need a mask on my face.
Along with that, see, one is prevention of that. But also along with that, we need to also improve the strength of our respiratory muscles. We need to improve our outlook towards escaping from pollution. Chalta hai attitude is something which we should shred off.
The negligence should be shred off. Definitely. So sir, do exercise and yoga, pranayama has any role in it?
Definitely. All the exercises, like I told, pranayam, you know, we are the pioneers of yoga. We've celebrated 12 years of international yoga days and everything. So you can imagine what impact it has across the world, globally.
Definitely.
So yes, previously we had more of indoor pollution. If you can recall, maybe you were in the barn that time, Aditi, but you know, there was only this fuel with wooden wood fuel stove and all that.
I've seen in the movies, sir.
But that time women were more prone to all these things. Now it is something else. So we need to keep our lungs safe.
Yes, sir. Definitely, sir. Sir, on the same line, I would ask you about recent changes in our life. So we are more digital beings now. Like we won't run around much, but we are so much exposed to the digital rays. Either it's the, you know, you're using a tab or a phone, or you're watching
like this?
definitely like this, or we are binge watching some series, some interesting series. So is it causing any hormonal imbalances in the present generation? Is it like stress or something?
If you ask me if it's causing hormonal imbalance, I think everyone knows it does. But to what extent it causes is something which we all should be aware of and know.
Yes, sir.
When you today, if you see, everyone is in that fast-paced life from morning till evening. Everyone wants a break.
Yes, sir. And a break is
it's more of digital. There is no more,
no social gathering.
Social gathering. You don't know your neighbors.
definitely.
Forget about neighbors. I don't think kids spend time with their own
Family,
parents, grandparents,
Yes.
anyone. In fact, there are houses, I think, with a good Wi-Fi connection who have their own individual tabs, they have 5-6 programs running parallelly.
Yeah, that's so true, sir.
But what happens is, if you see, there's something called a circadian rhythm.
Okay.
So circadian rhythm is something which will decide what hormones are at the peak at what time, and what hormones should go down. So in general, when we say,
I'm really sorry
Yeah.
to interrupt, sir. We'll just take a call. I think we missed it. It's okay, maybe they'll get back to us again. Yes, sir.
so when the hormonal rhythm, the circadian rhythm that I was talking, ideally we were set as the biological clock of the human. That's the circadian rhythm.
Yes.
So we said that when darkness sets in over a period of time to night, the hormone levels are supposed to go down. You're supposed to sleep peacefully.
Yeah.
But now you're in the midst of light always.
Yeah.
I don't think if you're inside your house, you will realize when the day is ended and when the night has begun.
No, definitely not. Even inside a building, we'll not get to know.
Yeah, so much of light is there. So what that does is it changes your biological clock completely.
Okay.
And over a period of time, there are a lot of changes in these hormones,
Okay.
which invariably leads to stress,
Okay.
what we call as sleeplessness, insomnia over a period of time.
Agitation, irritation, restlessness.
Over a period of time. It doesn't happen on day one, it doesn't happen on day two.
Yeah.
It happens over a period of time.
Okay.
And with that, many diseases start.
Can you just enumerate some? Like usually people think that PCOS or diabetes, hypertension, all these things are not related to our hormonal levels or fluctuation in that. But is it?
They are all related to if you see, they're all related to stress eventually in one way or the other.
Okay.
I'm not saying that is the causative factor.
Yeah.
But yes, it does contribute significantly to either these diseases coming early or being more aggressive.
Yeah. Okay. We got a call. Let's see. Hello.
ಹಲೋ
Hello. Yes. Good morning.
ಡಾಕ್ಟರ್ ನಾನು ರಾಹುಲ್ ಅಂತ
Yeah. ಹೇಳಿ.
ನಮ್ದು 34 ವರ್ಷ
ಸರಿ.
ಹುಬ್ಳಿಯಿಂದ ಮಾತಾಡ್ತಿದ್ದೀನಿ.
ಓಕೆ ರಾಹುಲ್ ಹೇಳಿ, ಏನ್ ಸಮಸ್ಯೆ ಇದೆ ರಾಹುಲ್?
ನಾನು ವೆಯ್ಟ್ ಲಾಸಿಗೆ ಇಂಜೆಕ್ಷನ್ ಮೆಡಿಸಿನ್ ಅದನ್ನು ತಗೋತಿದ್ದೆ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾದಲ್ಲಿ ನೋಡ್ಕೊಂಡು.
ಸರಿ.
ಅವು ರಿಯಲಿ ಸೇಫ್ ಆಗಿರ್ತಾವ ನಮ್ಗೆ?
ಓಕೆ, ದಟ್ಸ್
ಸೈಡ್ ಎಫೆಕ್ಟ್ ಅದೇನು ಏನಾದರೂ ಇರ್ತಾವ?
ಸರಿ, ಓಕೆ, ದಟ್ಸ್ ಅ ಗುಡ್ ಕ್ವೆಶ್ಚನ್. ಯಾ,
ನಾವು ಆರಾಮಾಗಿ ಅದು ಯೂಸ್ ಮಾಡಬಹುದಾ ಮ್ಯಾಮ್ ವಿತೌಟ್ ಎನಿ ಟೆನ್ಷನ್?
ಸರಿ, ಥ್ಯಾಂಕ್ ಯು ರಾಹುಲ್ ಫಾರ್ ಕಾಲಿಂಗ್. Such an important question, sir. They are asking on social media. He would have heard some medication for weight loss. So now he wants to know, can he continue it? So let's talk to our expert about the same. Yes, sir.
ಸೊ ನಮಸ್ಕಾರ ರಾಹುಲ್.
ನಮಸ್ತೆ ಸರ್.
ಏನಂದ್ರೆ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಯಾವುದೇ ಮಾತ್ರೆ ಆಗಲಿ ಯಾವುದೇ ಔಷಧಿ ಆಗಲಿ ದಯವಿಟ್ಟು ನನ್ನ ವಿನಂತಿ ಏನು ಅಂದ್ರೆ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ ನೋಡಿ ಅಥವಾ ಇನ್ಫ್ಲೂಯೆನ್ಸರ್ಸ್ ನೋಡಿ ದಯವಿಟ್ಟು ತಗೋಬೇಡಿ. ಫಸ್ಟ್ ಅಂಡ್ ಫಾರ್ಮೋಸ್ಟ್ ಯಾವತ್ತು ನಿಮ್ಮ ಡಾಕ್ಟರ್ ಹತ್ರ ಸಲಹೆ ತಗೊಳ್ಳಿ. ಯಾಕೆಂದ್ರೆ ದೇರ್ ಇಸ್ ನೋ ಮೆಡಿಕೇಶನ್ ಇನ್ ದಿಸ್ ಅರ್ತ್. ಐ ವಿಲ್ ರಿಪೀಟ್ ದಿಸ್ ಮೇ ಬಿ ಟೈಮ್ ಅಂಡ್ ಅಗೇನ್. ದೇರ್ ಇಸ್ ಓನ್ಲಿ ಒನ್ ಮೆಡಿಕೇಶನ್ ವಿಚ್ ಡಸ್ ನಾಟ್ ಹ್ಯಾವ್ ಸೈಡ್ ಎಫೆಕ್ಟ್. ಗೆಸ್ ವಾಟ್ ಇಸ್ ದಟ್?
Smile.
The medication does not have an effect. So every medication which has an effect will have a side effect.
Yeah, definitely, yeah.
So side effect ಇಲ್ಲ ಅಂತ ಇಲ್ಲ, ಬಟ್ ನಿಮಗೆ ಅದು ತಗೋಬಹುದಾ ಇಲ್ವಾ ಅಂತ ನಿಮ್ಮ ಡಾಕ್ಟರ್ ನಿಮಗೆ ಸಲಹೆ ಕೊಡ್ತಾರೆ. ಎಲ್ಲರಿಗೂ ಎಲ್ಲಾನು ಆಗಲ್ಲ. ಒನ್ ಸೈಜ್ ಡಸ್ ನಾಟ್ ಫಿಟ್ ಆಲ್. ಸೊ ಅವರ ದೇಹ ಪ್ರಕೃತಿ ನೋಡ್ಕೊಂಡು ಡಾಕ್ಟರು ಅದಕ್ಕೆ ಸಲಹೆ ಕೊಡ್ತಾರೆ ಏನ್ ತಗೋಬೇಕು ಏನ್ ತಗೋಬಾರ್ದು ಅಂತ. ಅಂಡ್ ಡೆಫಿನೆಟ್ಲಿ ಈಗ ಬರ್ತಾ ಇರೋ weight loss medications, there are multiple brands, I will not name them, but all those things have their own side effects ಇಲ್ಲದೆ ಇಲ್ಲ. ಸೊ ರಾಹುಲ್, ನೀವು ತಗೋಬಹುದು, ಆದ್ರೆ ವೈದ್ಯರ ಸಲಹೆ ಇಲ್ಲದೆ ತಗೋಬೇಡಿ, ಅದು ನನ್ನ ವಿನಂತಿ ನಿಮ್ಮಲ್ಲಿ.
That is very important. I think you got your message. Yeah, thank you Rahul for joining us. So yeah, that's a very, very important and a significant thing, because we all are addicted to social media. We all are like the bait for the social media. So we usually come across a lot of not only drugs, but like the weight loss medications, but also there is a weight loss diet which has been on the trend. Like some people say do intermittent fasting, some people say do keto, and a lot of other stuff. So I think the same holds for the others.
It just holds the same. It's the same way.
Yeah.
There are professionals. See, if your car, you come by car, you come by vehicle, whatever, it gets punctured. It breaks down.
Yeah.
You need to go to the right mechanic to do it.
Definitely.
You can't see a social media thing and try to fix it.
Yeah.
And then you end up harming it more.
Yeah.
Probably landing in a bigger trouble.
Yeah. Okay, so we have one more call. Let's see. Hello? Hello? Hello, good morning. Hello?
Hello.
Yes, sir, Heli.
I would like to talk to Dr. Rama Mishra.
Yes, he is right here with us. You can definitely speak to him.
Hello.
Good morning, sir.
Hello.
Yes, sir. I can hear you. Good morning, sir.
Yes, sir. Good morning, Dr. Rama Mishra. Good to see you in the live program.
Thank you, sir.
So I have been your patient to take care of my sleep weakness.
Yes, sir.
So do you have any help on people who are having similar issues?
Yes. So we were discussing about 2 minutes back about the sleeplessness, or what we commonly call as insomnia in medical terminology.
Yes, sir.
So there are different problems in this sleep disorders.
Okay.
Some people have initiation of sleep problem,
Okay.
and some have problem maintaining it after a few hours.
Okay.
So we need to identify what is their basic problem.
Kind of problem, yeah.
Yeah. And people have to realize that just like any other thing, just like you have hand hygiene, there is something called sleep hygiene also,
Okay.
where you don't force yourself into sleep every single time.
Okay.
So what our caller told was very apt.
Yeah.
There are a lot of people suffering with this, but they don't want to come out in the open and talk about it.
Definitely.
And whenever they do, majority of the times, it's okay, I will not give you medications. Medications are addictive. These are the type of responses they may get. But
Even I have done this once with a patient.
yeah,
But
so
yeah.
it may not be valid.
Yeah.
Because we need to identify what is the root problem.
Yeah.
Sometimes it could just be deficiency of a few minerals and vitamins.
Okay.
Sometimes it could be what we were talking about, stress related, something called melatonin.
Okay.
So if melatonin is impaired because of the sleep-wake cycle, so that itself can lead to a lot of sleep problems. You will see typically that in jet lag.
Yeah.
When you travel somewhere, that typically resets the cycle. I was talking about biological clock. The same thing happens here. So we need to identify the root problem, and accordingly we need to treat whether the initiation of sleep is the issue or maintenance of the
The
sleep.
sleep is the issue.
And depending on that, definitely there are doctors here out to help you and educate you about the sleep hygiene, which will help you.
This is a new term, sleep hygiene, for me at least.
Yes.
So, okay, that's something which we have to take care of. Sir, did you get your answer, sir?
Is there any impact of social media? I use of social media extensively on the sleep problem.
Definitely, sir. I can vouch for it.
So yes, sir. Social media is the biggest problem right now because it's too addictive.
Yeah.
You have
We won't
reels
sleep.
which you don't have to concentrate for a long time.
Yeah.
Over is the time of test matches or movies on big screen.
Yeah.
Now is the era of T20. Everyone has a small concentration gap.
That's
So
yes,
30
sir.
seconds reels, you can just go on scrolling, and people are addicted to the light emitting from phones or anything. That light, like I was telling, is not good for induction of sleep.
Yeah.
There are specific types of light also
Okay.
which are helpful for sleep. So
Okay.
these lights which keep changing, they're not good for inducing sleep.
Okay. So I think he's trying to talk about the detox. Like every day we should have some digital detox before sleeping.
Honest suggestion, before going to bed, before your planned time of sleep, please stay away from all light emitting screens at least for 30 to 60 minutes before you go to bed.
Okay, that's a big thing to do, but yeah, I think it will help us.
Don't sleep with your gadgets.
Okay. Okay, we'll try, sir.
Thank you, sir.
Thank you for joining us today.
Thank you.
It's quite significant, sir. Detox for 60 minutes. Sir, on the same line, like we are talking about the digital things already. So, like 10 years back, I think smoking and alcohol de-addiction centers were there. So is there something coming up for digital detox also?
Yeah, of course. As we're talking, there are a lot of places which boast of digital detox.
Okay.
Even in Bangalore, there are places for even NIMHANS has suggested about the digital detox,
Okay.
and it is very important.
Okay.
We may not realize it, but sitting is a new smoking.
Yeah, that's there. Sir.
That's what the world has realized.
Yeah.
You sit for long, it's as good as smoking. That much risk it is to sit. And what do you do when you're watching social media? You're not walking around.
We're eating. We're sitting and eating.
Yes. So it's the harbinger of diseases.
Definitely.
But what is worse in the current generation or in the current trend, what is happening is children.
Yeah.
Children are addicted. I think there was a time when children were being shown the street dogs, the cows and the buffaloes and all that, and then you
to
see,
play in the colonies.
yes, go eat,
Yeah.
feed, seeing them.
Yeah.
But today is a time when you're asking them to see something on the YouTube channel,
Yeah.
which is the bus goes this and all that, and
Yeah.
then they're fed. So what happens is there is no verbalization. They don't have to think.
Yeah.
It's just playing. So what happens when you don't think for one day is okay. When you don't think for months, years, what happens? The child which is supposed to talk,
Yeah.
which is supposed to start vocalizing, doesn't do it.
Yeah. So there is a mental development which is hampering there.
Delayed. Their speech is delayed.
Yeah.
Their development as such is delayed. People should realize this.
Parents usually think because I'm busy with my own stuff, so let me just give the phone to the kid and let him play around.
Yes.
But that actually is harming.
It is harmful,
Yeah.
which people are not recognizing initially.
Yeah.
And there are a lot of people, parents standing out there, going to a neurologist, going to psychiatrist to see why their child is not, vocalizing, why the child is not behaving normally with everyone, because there is no socialization. When is the last time when people took their kids out for a function with everyone? Everyone now feels bored.
Yeah.
Few minutes and phone is not there. It's like, there are a lot of WhatsApp messages, jokes. I would like to quote one.
Okay.
Phones are like baby diapers.
Okay.
Whether it pees or not, you need to keep checking the diaper. Like that, whether you have a message or not, you keep checking your phone whether I have a message.
That's true. That's not just a joke. We do it, sir, actually.
So that's the degree of...
And it causes a lot of anxiety also. All the time you have to keep. It's like some obsessive compulsive disorder.
people don't
You
want to
have
get bored.
Yeah. Okay.
People are they're scared of being bored.
Yeah, they're scared of being alone. They're scared of being with themselves.
Yes.
So they're just always into something. They're bored of their life. They don't want to commit a lot.
True.
So they're like, okay, let's change something else.
So yes, the new era is of digital detox.
Yeah. A Chotu baby, like a kid in her home. So she makes sure that she's not using screen with the kid.
Oh,
So
yes.
she used to paint with the kid.
Yes.
And she spent like out of the whole hectic schedule of hers, she is dedicating some amount of time to the growth of that kid, and that's very inspiring.
It is important.
Like we should understand that we have to get the screen off from our kids and for our lives
Both.
also.
Both.
Yeah,
Kids
definitely.
more for their development, adults to reduce their stress. You don't need that information.
Yeah.
It's not going to make you any better.
Yeah, definitely. And there's a lot of crap out there more than important information. Okay, so there's one more caller for us. Hello?
Hello.
Yes, good morning.
Hello.
Hello, good morning, sir.
Good morning. It's Afzal.
Yes.
From Whitefield.
Okay. Yes, tell me, Afzal, what has happened?
No, I'm not audible properly.
Yes, tell me, you are very much audible to us. Please tell me what is your problem?
Ma'am, I have a dengue virus during rainy season.
Okay.
It's a common flu.
Okay, so you got dengue fever in the rainy season.
I'm not audible properly.
We can hear you, Mr. Afzal, we can hear you.
I think he's worried about he had dengue fever and now he wants to know whether in the rainy season he should have some precautions or something like that. Maybe.
Okay, so yes, we are due for our monsoons.
Coming.
And if you ask me, are we at risk of any infections like this? Definitely yes.
Okay.
There are mosquito breeding sites, multiple places across the city.
Yeah.
So,
Yeah. Yes, sir.
so with that being the case, we need to be first aware of our surroundings, that we don't have some water puddles that are there,
Yeah.
breeding sites for the mosquitoes, and then have diseases. That is one part of it.
Yeah,
That is the
definitely.
social part and being aware of it.
Yeah.
But the other part is individualistic. There are things, have good food,
Yeah.
good sleep for better immunity.
Okay.
But if mosquito bites with dengue, you cannot prevent anything.
Yeah,
So the way to
definitely.
prevent is wear good full sleeve clothes.
Yeah.
You have a mosquito net at home.
Mm-hmm.
Don't leave your doors open, especially in the evenings, late evenings when they come in.
Yes, sir.
So these things, that is with respect to mosquito-borne infections.
Yeah.
But also there are a lot of other infections, including after a good rain, there may be snakes which come out,
Yeah.
and people are prone for snake bites also.
Okay.
So you need to be careful about all these things.
Okay.
And with respect to other infections, I think now I will take this opportunity to address that also. This is a time when there are a lot of
Yeah.
flu-like symptoms.
It's happening, sir. Again, people started coughing, and every time they cough, we get scared. Like, is it coming back? Yeah.
So people have forgotten there was just about 5 years back, we were in the midst of a big pandemic,
Yeah.
COVID. People have forgotten. People have thought that, okay, it's not going to happen again.
Yeah.
It may not happen again,
Yeah.
but if you have a respiratory infection, simply wear a mask to prevent infection to your own kith and kin.
Yeah, that's true.
That itself will reduce the disease burden in the family and across the globe.
Definitely, sir.
And there are different vaccinations. People can go for those. So
Okay.
there are simple measures, and like I told, there are ways of preventing them,
Yeah.
and there are ways when you feel it's beyond you.
Yeah.
Again, don't do the OTC, over the counter stuff.
That's very important, because people usually take medication, especially antibiotics, sir. They'll take left and right whenever they have like some stomach pain, some cough and cold. Every person on the medical store feels like they are the consultant, and they'll just give it just like that.
See, let's be honest. Unfortunately, in our country still, pharmacy does tend to give medications even without prescriptions.
Yeah, they do, sir.
So
That's the big threat.
I think there has to be a statutory thing for that, where
Yeah.
antibiotics, or at least majority of the medications which we know are harmful,
Yeah.
should not be given without prescription.
Yeah.
But to begin with, at least we can be more
Yeah.
aware. Our patients can be a little more
Yeah,
aware of the
definitely.
fact that they
are
should not
aware,
do it.
Yeah, they will definitely not go and get it from there.
I would
Because-
say things are improving.
Yeah.
Patients do come,
Yeah.
but it needs to be at a bigger mass level.
Yeah, the awareness should be a little more.
Yes.
That's why we are just trying to do here, sir. At the same line, sir, I think because he told he had dengue in the previous monsoon season. So are the people who already had dengue in the previous season, are they more prone for it? Or if it happens to them, is it more serious or severe?
Yeah, nice question.
Yeah.
Because there are a lot of people who feel once they're infected, they somehow believe that they cannot be infected the second time.
Yeah.
While this may hold true for a few infections,
But dengue, it's
yeah,
little
it may
tricky.
hold true for a few
Yeah.
infections, but there are infections which can happen repeatedly.
Yeah.
They can be occurring again and again. Dengue is one of them.
Yeah.
It can happen. But the second one, again, it may be totally asymptomatic. It may just come as a little fever and a body pain and may go off, or it may come back with vengeance,
Yeah.
and it might be really bad for you.
Yeah.
So no one can predict. That's all. Of course, there are different strains and all that. That's not practically feasible, which will say which strain next we test for all. That's
Yeah.
not practical. But be rest assured that there are infections which you can get again and again, and they can be more serious than the previous time also.
Yeah, so if at all any time in doubt, just go and consult the right person at the right time. That
Yes.
may help. And sir, I would like to ask one more thing. So we have discussed it before also about hypertension specifically, that how much amount of salt is enough, and how do patients can understand that, okay, this much is fine for me.
Yeah, so hypertension, everyone, I think practically everyone knows that salt is the biggest culprit.
Yes, sir.
Any guesses how much salt you would take, Aditi, in a day?
I think 1 to 2 tablespoons.
Much more than that. Average Indian salt intake is more than 10 grams, more than 2 tablespoons.
Okay.
And one pickle will do the job. If you're taking
Seriously?
pickle, yes,
Oh, okay.
one pickle will do that job. That's the amount of
I
salt you
have to
take.
reanalyze then.
But
Yeah.
even I have learned this over a period of time. There are multiple forums which keep repeating this.
Okay.
How do you know how much salt to take?
Yeah.
I would say 1 tablespoon.
Okay.
Now, the common doubt is, doctor, we prepare breakfast,
Yeah.
we have snacks,
Yeah.
we have lunch, we have dinner.
Snacks in the evening.
How much salt is there? How do I know
Yeah.
how much salt from morning till evening? That's the thing.
Yeah.
One simple solution is put 1 tablespoon of salt in 1 glass of water.
Yeah.
That is the amount of salt you need for the entire day's cooking.
Yeah.
That water, the salt water that you take, use that for all your cooking from morning till night.
Okay, so that is what something which I really liked after listening from you. So I wanted everybody to know that this is how we can manage it.
Yes, and if you're a family of 5, it's 5 tablespoons in that water, and you can use that for all of them.
Yeah.
It's good for the future.
Yeah, definitely.
Here we should be concentrating more even on prevention.
Yeah, definitely. So would you like to speak something about ambulatory blood pressure monitoring? So is there something like that? And
Yeah, ambulatory
Yeah.
blood pressure monitoring has been there,
Yeah.
and now it's more advanced.
Okay.
Previously there were big machines and all that. Now it's more simplified.
Okay.
When we use this ambulatory blood pressure monitoring is of importance. So ambulatory blood pressure monitoring is something which a small machine is attached to you,
Okay.
and it keeps recording the blood pressure for 24 hours.
Okay.
Through and through your wakeful period, your work.
Okay.
That means whenever you're stressed also it picks up. When you sleep. So
Okay.
ideally when you sleep it should dip down.
Yeah.
So through and through that, it's going to record. It's going to give us an average
Okay.
of how much in the entire 24-hour period the BP was, and that is the gold standard. I
Okay.
would say before branding someone as hypertensive, especially on the first time or the second time,
Yeah.
and especially in those patients who say, "Doctor, when I came to you, my BP increased."
Yeah, yeah.
That's we get to hear that a lot.
Yeah.
I-
White coat
outside I'm okay.
hypertension.
Yeah. Outside I'm okay.
Yeah.
As soon as I came in,
Yeah.
I have my. So there's a
Yeah.
joke that I usually make. That's why I'm not wearing the white coat and I'm sitting sometimes. So,
Okay.
but yes, it's
Yeah.
white coat hypertension, well-known fact. But there's also something else
Okay.
called a masked hypertension.
Okay.
So you might end up having that a person might come to your setup
Okay.
to the hospital and BP is normal, but you see that the patient already has some damages happening in their kidneys or their eyes because of hypertension. Because
Okay.
when they go back, the BP may be high, may be fluctuating.
Okay.
So for all these things, ambulatory blood pressure monitoring is a fairly good answer. I'm not saying it is the go-to, but yeah, it's a fairly good solution.
Yeah, we'll have a recording at least so we know if it is going high or low or what is that. Sir, on the same lines, usually in our surgical OPD, we see patients who come with long-standing wounds on the legs. Mostly it is on the lower limb, on the legs, which are not healing. And when we retrospectively ask them, we get to know that they were diabetic. Some 10 years back, they were diagnosed, they started medication, and then on their own, they decided one fine day that I am good enough and I don't need these tablets anymore. So, do you have any say about this discontinuation happening?
No,
Okay.
we will take that.
Yeah, we'll take the call. Hello.
ಹಲೋ
Good morning, sir.
ಮೇಡಮ್ ಕೋಲಾರಿಂದ ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ.
ಹಾಂ ಸರಿ ಹೇಳಿ ನಿಮ್ಮ ಹೆಸರು ಏನು?
ಹೆಸರು ಬಂದ್ಬಿಟ್ಟು ಅಭಿಷೇಕ್ ಅಂತ.
ಸರಿ ಸರಿ ಹೇಳಿ ಅಭಿಷೇಕ್ ಏನಾಯ್ತು?
ಮೇಡಮ್ ಇದು ಲಾಸ್ಟ್ 3 ವೀಕ್ಸ್ ಇಂದ ನಾವು ಕೆಮ್ಮಿದೆ ಜಾಸ್ತಿ.
ಹಾಂ ಹಾಂ
ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ನಾವು ಕೆಮ್ಮು ಇದು ಸ್ಮೋಕ್ ಕೂಡ ಮಾಡಲ್ಲ.
ಸರಿ
ಅದಕ್ಕೆ ಇಮಿಡಿಯೇಟ್ ಆಗಿ ಚೆಕ್ ಮಾಡ್ಬೇಕು ಮೇಡಮ್ ಅದಕ್ಕೆ.
ಸರಿ ಸರಿ ಓಕೆ. So sir, he is having cough, but he is not a known smoker. So now since 3 weeks I think. So he is asking.
ಸ್ಮೋಕ್ ಮಾಡಲ್ಲ.
ಸರಿ ಹೇಳಿದ್ದೀನಿ ಟೆನ್ಷನ್ ಮಾಡಬಾರ್ದು ಹೇಳಿದ್ದೀನಿ 2 ನಿಮಿಷ ಇರಿ.
ಅಭಿಷೇಕ್, ನಿಮ್ ಕೆಮ್ಮು ಜೊತೆಗೆ ನಿಮ್ಗೆ ಸ್ವಲ್ಪ ಜ್ವರನೂ ಇದೆಯಾ?
ಇಲ್ಲ ಸರ್, ಬರೀ ಕೆಮ್ಮಿದೆ ಸರ್.
ಓಕೆ,
ಸರಿ
ಸ್ವಲ್ಪ ಓವರ್ ಕೆಮ್ಮಿದೆ.
ಸರಿ. ಏನಾದ್ರೂ ಉಸಿರಾಡ್ಬೇಕಾದ್ರೆ ನಿಮ್ಗೆ ಸ್ವಲ್ಪ
ಬ್ರೀತಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತೈತೆ.
ಹಾ. ಸೊ ಅಭಿಷೇಕ್, ಏನಂದ್ರೆ ಕೆಮ್ಮು ಅಷ್ಟು ಲೈಟ್ ಆಗಿ ತಗೋಬಾರ್ದು, ಎಸ್ಪೆಷಲಿ ವೆನ್ ಇಟ್ ಇಸ್ ಇಷ್ಟು ದಿವಸ ಇರ್ಬೇಕಾದ್ರೆ. ನಮ್ಮ ದೇಶದಲ್ಲಿ ಪರ್ಟಿಕ್ಯುಲರ್ಲಿ ಕೆಮ್ಮು ಬರೀ ಕೆಮ್ಮು ಜ್ವರ ಇಲ್ದೇನೂ ಎಷ್ಟೋ ಸತಿ TB ಕಾಯಿಲೆಯಿಂದಾನು ಇರ್ಬೋದು. ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕಾಗುತ್ತೆ, ಕಫ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಬೇಕಾಗುತ್ತೆ ಒಂದು. ಎರಡನೇದು, ಇನ್ನೆಷ್ಟೋ ಸತಿ ಆಸ್ತಮಾ ಅಂತ ಕೇಳಿದ್ದೀರಾ?
ಕೇಳಿದೀವಿ ಸರ್.
ಹಂಗೂ ಆ ಬ್ರೀತಿಂಗ್ ಪ್ರಾಬ್ಲಮ್ ಇಂದಾನು ಎಷ್ಟೋ ಸತಿ ಕೆಮ್ಮಿರ್ಬೋದು. ಬಟ್ ಇದು ಮೇಜರ್ ಕಾರಣಗಳು. ತುಂಬಾ ಬೇರೆ ಕಾರಣಗಳು ಇರುತ್ತೆ ಅಭಿಷೇಕ್. ಅಂದ್ರೆ ಬರೀ ಲಂಗ್ಸ್ ಶ್ವಾಸಕೋಶದ ಸಂಬಂಧಪಟ್ಟ ಹಾಗೆ ಇರಬೇಕು ಅಂತಾನೂ ಅಲ್ಲ, ಅದಿಲ್ದೇನು ಬೇರೆ ಕಾರಣಗಳು ಕೆಮ್ಮಿಗೆ ಇರುತ್ತೆ. ನೀವು ತೋರಿಸ್ಕೊಳ್ಳಿ. ಬಟ್ ಫಸ್ಟ್ ಅಂಡ್ ಫಾರ್ಮೋಸ್ಟ್ ನೀವು ಇಂಪಾರ್ಟೆಂಟ್ ಇಸ್ TB ಕಾಯಿಲೆನ ರೂಲ್ ಔಟ್ ಮಾಡಬೇಕು, ಅಷ್ಟು ಇದ್ದರೆ ಕೆಮ್ಮು.
ಸರಿ. Okay, thank you for joining us. I hope you got your answer. Sorry, thank you for joining us. I think you got your answer.
Okay.
Yeah, thank you.
Thank you.
I just completely went off track, sir. What I was asking you?
Talking about wounds, but before going to that, I will take this opportunity to say that India is not, we are also the diabetes capital.
Tuberculosis.
We are also the tuberculosis capital.
Capital of many
So,
things, sir.
Yes.
But
So
not
when
very
the caller told about cough, the first thing that came to my mind was
Yeah.
that there are a lot of people who come with cough.
Yeah.
And they ignore this symptom for a long time, telling that it's just a cough, it's just a cough.
Yeah.
But if it is tuberculosis, possibly they would have spread to their family first thing.
Yes, sir.
Second, it slowly eats up. It slowly eats up.
Yeah. Hello.
Hello.
Yes, tell me. Good morning.
मेरे किसी भी बात की टेंशन होती है, घबराहट हो जाती है, पेट खराब हो जाता है,
Okay.
तो इसके लिए कैसे क्या करना?
अच्छा ठीक है, आपका नाम और आपकी उम्र बता सकते हैं प्लीज?
मेरी उम्र है 56।
56 इयर्स, ठीक है.
मतलब घबराहट हो जाती है, पेट खराब हो जाता है, टेंशन हो जाए किसी बात की.
अच्छा, so the viewer, actually the caller is telling whenever he is
मेरा नाम पंकज है.
पंकज हैं, ठीक है, उनको जब भी किसी चीज की टेंशन है, when he is tensed about something, he is having some GI symptoms like stomach gives away or sometimes he'll have loose motion, something like that.
तो पंकज जी, कितने बार होता है ऐसे? दिन में हर रोज ऐसे होता है या कभी कभी होता है? I
Hello.
think we missed the call. I think it got cut, but either way, we'll take the thing.
Yeah.
So
I think it is associated with the restlessness, like
Yeah, that's
when
what-
he's having anxiousness
So
at that time.
we need to figure out whether it's only that
Yeah.
or it happens every other time.
Okay,
Every patient has to know a couple of danger symptoms.
we got the call back.
Yeah.
Okay. Hello.
फोन कैसे किया था?
हाँ, कोई बात नहीं.
हेलो.
हाँ, हम सुन रहे हैं, आप बोलिए.
जब भी किसी बात की टेंशन होती है, पढ़ाई की टेंशन होती है, किसी भी चीज की,
हाँ,
तो फिर ये सब पेट वेट खराब हो जाता है, सब गड़बड़ हो जाती है इसमें एक बार.
ओके, ठीक
So-
है.
So
काम की टेंशन होती है, व्यापार की.
Okay. ठीक है. Okay, let's talk to our expert now. Let's see what he has to offer. Yes, sir.
so I think what Mr. Pankaj is telling
हाँ,
is fits into the classical what we call irritable bowel syndrome.
okay.
So whenever they're anxious, whenever they're stressed,
Uh-huh.
they have this typical feeling of my abdomen is cramped up. I have a lot of, we call it as a functional GI. It's a functional GI disorder where
Okay.
there's really nothing inside the gut where we need to do some tests or something.
Okay.
However, tests are done for all these patients to rule out other
Other causes,
problems.
and when there's nothing else, then we come back
Yes,
to.
then we
okay.
call it as irritable bowel.
Irritable bowel.
Looks like what he's telling is something like irritable bowel.
Okay.
My suggestion is to meet a physician, a gastroenterologist to get evaluated for the same.
Okay.
It's a very simple treatment. If it is irritable bowel, they don't have to really worry.
Okay.
Usually they do not have major complications going ahead. It's more with the gut brain axis,
Okay.
with the stress.
Oh, that's a beautiful connection. We have read it across also that the
Yes.
gut and the brain has a good connection.
Yes.
Gut is healthy, your brain is healthy. Or
Correct.
likewise.
And vice versa.
Yeah, definitely.
So it looks like what he's telling us, but
Yeah.
it could be mimicking other diseases also. So we can never be too sure.
Okay.
Anyone who has symptoms like this, first get evaluated properly for
Rule out the other causes.
other causes.
Yeah.
There are multiple myriad of causes, including drugs, including some medications that they're taking.
Okay.
It could be simple anti-diabetic medication.
Okay.
It could be anti-hypertensive medication. It could be something else which they're on. These medications also can cause symptoms.
Okay.
So they need to get
Get evaluated.
evaluated for that.
Yeah.
And if that is not there, then I would, boldly say that it fits into irritable bowel syndrome, and all he needs is work on his stress, one end,
Okay.
and on the other end, all that he needs is a little medication to help him.
ओके, तो हमारे व्यूअर के लिए हमारे एक्सपर्ट ने बोला है कि यू हैव टू, आपको पहले रूल आउट करना है बाकी सारे कॉजेस को, इवैल्यूएशन करना है, एंड उसके बाद में अगर कोई और चीज नहीं है, कोई और बीमारी नहीं है, तो स्ट्रेस लेवल पे काम करना है. अगर स्ट्रेस लेवल पे काम करेंगे तो हो सकता है कि आपको जो भी पेट की गड़बड़ है या जो भी परेशानी हो रही है वो भी सेटल हो जाए. तो इट्स लाइक कि आपका ब्रेन और आपका गट, इंटेस्टाइन एक दूसरे से जुड़े हुए हैं. तो अगर दिमाग में कुछ गड़बड़ चल रहा है तो पेट में गड़बड़ हो सकता है. Okay, sir. So moving ahead with the same question, sir. We had a patient. I told you he has wound over the
Yes.
leg.
I will come back to that.
Yeah. Diabetic irregular. Okay.
I think they're not letting us talk about that.
We'll come back soon. Hello.
We had a patient. I told you he had no.
What happened?
Hello. Okay, I am not sure. Hello.
Yeah,
Yes.
now I think.
Hello. Good morning.
Good morning.
Hello.
Hello. Good morning.
Good morning.
Yes. आपका नाम बता सकते हैं?
Yes. My name is Shubha.
Okay.
Good morning, sir.
Good morning.
Can you tell
Good-
your problem?
I am Shubha.
Yes, good morning, Shubha. We are audible to you? We are audible to you. You are audible to us, Shubha. Are we audible to you?
Yes.
ये-
Actually, नहीं हो पा रहा शायद.
आप कोई बात नहीं, आप बोलिए, आपकी आवाज हमें आ रही है.
या सर, मेरा एक क्वेश्चन है कि जैसा कि आपने कहा जो स्ट्रेस है उसको अगर अपन काम करें
Stress.
तो जो एंजाइटी वगैरह है वो खत्म हो सकती है.
या बिल्कुल हो सकती है.
तो लेकिन अपन स्ट्रेस लेवल कम करने के लिए क्या मेडिसिन ही है इसका, या योगा, या अदर क्रिया, या मेडिटेशन, बट उनसे भी वो प्रॉब्लम सॉल्व नहीं होती. इमीडिएटली हो जाती है बट वो एक समय के बाद वापस आ जाती है. तो सर इसका क्या उपाय बताइए सर.
Okay. Thank you. A very interesting question and a very general life related question. कि सर सिर्फ medicine is the only treatment for the stress, or is there anything else?
No, I think the caller herself is
Told
told
that meditation
that
and all.
yoga, meditation, everything is happening.
Yeah, but
So,
still stress.
despite that,
Yeah.
when things happen, yes, it happens.
Yeah.
You know, there is a yoga, meditation, everything is there,
Yeah.
and they all help you.
Yeah.
But at the same time, there are times when you need external help also.
Yeah.
So that is the time when you need medications. But medications are not the only solution for everyone.
Yeah.
So I would say yes, please continue with yoga, meditation, everything that is there.
Yeah.
They all help you. But despite this, if you need an add-on,
Yeah.
you're still not able to handle it, then definitely you need to meet your
Consultant.
appropriate consultant to
Yeah.
handle your stress.
Yeah.
They may help you again with a medication for a few days, or they could just to take you through a few counseling sessions, which may itself be beneficial.
Yeah.
Not every time will they
You
prescribe
need-
medications.
Definitely. Sometimes just talking out your heart can also
Yes,
help a lot.
it also helps a lot.
Yeah.
So I think Shubha ji,
Hello.
I think that is the ideal way to go about.
Okay. मुझे लगता है आपको आपके प्रश्नों का जवाब मिला है.
Yes, yes, sir.
Yeah.
Okay.
Thank you, Shubha.
Thank you.
Okay.
Okay. Yeah.
So yeah, every time
You don't need medication.
let's leave behind the taboo of psychiatrist. मतलब दिमाग खराब हो गया.
Yeah. That's a
Mental
big
hospital.
taboo, sir. That's a big.
Yeah. It's not like that.
Yeah.
It could be genuine. See,
Yeah.
like you were telling, we'll come back to that, but I'll just add to that about the diabetic foot.
Yeah.
There may be a lot of people who could control their blood sugars by doing good dietary changes,
Okay.
exercises.
Yeah.
Of course, there's a fad of diabetic reversal also. Though it is not a cure, people could definitely reverse the process
Okay.
of increasing sugars, of insulin resistance and all that.
Okay.
But when it's beyond them, they always should seek help. Medications are there to help you along with what you're doing. It is never a replacement for what you're doing.
Okay.
You should continue to do it. Healthy lifestyle is always
The gold standard.
first priority and the gold standard.
Yeah, definitely.
It's only when it's not helping then
Yeah.
you need to take help. So when you have fever, we had one caller. So when you have fever, first 2-3 days you do your home remedies, all that doesn't help, then you go to a doctor.
Yeah.
When you have diabetes, when your sugars are high, you try doing these things, whatever you know, try cutting off your carbohydrates and all that, and after that still it's not there, you go and meet the specialist.
Yeah.
Likewise, if it is stress, don't keep it as a taboo that no, if
What
I go
people
there,
will
it's a
say.
psychiatrist, what people will say.
Yeah.
It's not like that. You're just seeking help.
Yeah.
So there is no harm in going out there and saying, I am going through this period of stress.
Yeah.
Please help me out.
Yeah. This is something which I've seen with the recent generation. So they're very vocal about their emotional and mental state.
Really?
Yeah. I'm like, people usually be like, I'm very depressed today. Although nothing has happened, it was just a hard day. I am very depressed. These are the words which were.
That could be another extreme, you know.
Yeah.
And that goes back to where I started. People don't want to get bored. They constantly want to be entertained.
Yeah.
And when they are not for a few minutes, maybe they start feeling that is depression.
Yeah.
So that is the other end of the spectrum.
Definitely, sir. Nowadays, generation is more vocal, I feel.
Yes. But coming back to your question about sugars and diabetes. So one of the reasons why that wound was possibly not healing or just going on was because his sugars was not controlled.
Yes, sir. That was the thing, actually.
In fact, many people at the presentation itself, at the beginning itself, they come to us with a non-healing wound, non-healing ulcer.
And we eventually find out that they are diabetic.
Yes, they say, Doctor, el gaya aito maitane illa ಎಷ್ಟು ದಿವಸ ಆದರೂ ಹಂಗೆ ಇದೆ ಡಾಕ್ಟ್ರೆ ಏನೇನೋ ಆಯಿಂಟ್ಮೆಂಟ್ ಹಾಕಿದ್ವಿ ಹೋಗ್ತಾ ಇಲ್ಲ. This is the usual thing that they say. So one of the symptoms is that some of them do take a decision to stop their medications because they are asymptomatic. We usually say that diabetes has more urination, more thirst and all that. So patients attribute those symptoms to being high sugars. When they are not there, when they are treated, when these symptoms subside, they constantly think that, okay, now these symptoms are not there, so I don't think I have any more high sugars, so it's time to stop. But that's not true.
Okay. Hello.
Good morning, doctor.
Good morning.
I am Priya, 24 years old.
Okay.
From MG Road. There is so much healthy advice on social media about fasting, diets, drinks, and different diets. How can we know what's actually health and what's just trend?
Thank you, Priya, for asking such a relevant question. So what is just trend and what is the good health? Definitely. Sir, can you please tell something about it?
Hello, Priya. Good morning.
Hi, doctor. Good morning.
Did you have your breakfast?
No, doctor.
You're fasting?
No.
So, you know, fasting is good. I would say fasting is good for a few hours or for once in a while. Fasting is good, but it's not a thing that you keep following every day of your life. And there are specific methods by which you restrict your calories. That is more important. Calorie restriction is more important than just fasting for, days or hours and all that. There's some specific ways where you do a healthy diet, a balanced diet without really, fasting. So fasting is not the only important thing. And don't be carried away by social media again saying you should do keto diet for doing this, you should do that diet for doing this. I'm not saying you should meet a doctor for that. There are certified dietitians who can help you out with that.
Definitely.
And there are different diets for weight loss, for achieving better glycemic control, for for hypertension. There's something called Mediterranean diet or a DASH diet we call. So there are different types of diet for each of them, Priya.
But that is very much individualized. Like how you are very unique, your diet is going to be unique for you. So you have to make sure that you speak to somebody who knows about it really well. Okay, Priya?
Thank you.
Thank you for joining us today.
Okay, thank you, doctor.
Yes, sir. So coming back to diabetes, I would really want you to tell us something about some myths related to diabetes. Like some patients will tell that I have just left the sugar out of my diet. I've stopped eating all sweets and I'm not taking sugar in my coffee and tea. Is this the only thing, or do they know something else should be done?
That's like telling this. This is like, fasting. So leaving sugars alone is not enough. Leaving sugars is just one part of the game. So other than sugars, there are other carbohydrates that people have to be aware of. And it's not just about sugar. I've heard people saying that, Doctor, sugar bitpudi tintane illa doctor nanno and all that.
But sugars are still very high.
I had one instance like this. So I was treating this patient and sugars are continued to be high. Despite, first I stopped the sugar and I asked about the jaggery. So these were things, Bella, savayava bella, organic bella, doctor. So it's like as though organic bella is made of something else.
Else than
So this is a
carbohydrate.
myth.
Yeah.
And along with that, there are people who tell that I've stopped other things and all that. So when I found out, I found this couple, cute couple.
Okay.
They come to regular consultation. Only her sugars were not getting controlled. I was like, what else? What else? When I then just at the time when they were leaving the OPD, the husband told, Doctor, ದಿನ ಒಂದು ನನ್ನ ವೈಫಿಗೆ ತುಂಬಾ ಇಷ್ಟ ಐಸ್ ಕ್ರೀಮು, ದಿನ ಒಂದು ಐಸ್ ಕ್ರೀಮ್ ತಿಂತಾರೆ ಪರವಾಗಿಲ್ವಾ?
Such a loving husband, but yeah, at the same time, it's not.
So it's not just about the sugars always.
Yeah.
It's carbohydrates in any form.
Yeah.
It could be in any form. For that matter, rice,
Yeah.
ragi, every cereal that is there
Yeah.
is having carbohydrates.
That's very important because I have also seen patients saying we are taking ragi dosa instead of the plain dosa.
It's not going to help.
Yeah.
Ragi mudde is not going to help.
Yeah.
You're taking ragi mudde, my sugars will control. It's not going to
Okay.
help.
So if they are cutting on carbohydrates, so what should they take then instead of it?
Yeah,
Like-
you're asking instead of it or with it?
No, definitely not with it. We are tapering down the carbohydrates.
Yeah,
Then
so
what else?
it's not with it.
Yeah,
You should always remember that if you want to control your sugars
Yeah.
and you're replacing, when we say don't eat rice, now
Yeah.
you cannot take little rice and then add on something more and more to it.
Yeah. Okay. Hello. Good morning.
Good morning. I am Sudha from Bangalore.
Hello, Sudha.
My question is, what is the ideal HbA1c level after which I'll be called diabetic? Because earlier it was 6, now it has become 6.5. So why does it change and what should I watch out for?
Yeah, definitely. Such a relevant question. Sir, could you please answer her?
Good morning,
Sorry.
Sudha. I think it got disconnected.
Yeah, but
I'll
she
take the
can
question.
see us
either.
live,
Yes.
yeah.
So yes, there is variation. A lot of people has spoken about this also.
Yeah.
There is variation in the levels which we define diabetes and all that. That happens over a period of time, over a lot of research.
Okay.
Where people do a lot of research at this level, whether there is any eventual organ damage.
Okay.
That's what we look for.
Yeah,
Now,
definitely.
organ damage is something. Diabetes and hypertension, they're not just sugars being more or BP being more. They cause something. That causative effect is organ damage. So over a period of number of years of research and lakhs of people out there, then the values are coming to
Okay,
picture.
so what can you just enumerate more about this organ damage, sir? To the general public who doesn't know what and all it can do.
Name an organ, Aditi.
Brain,
It can damage that. Name one more.
okay, your kidney, liver.
So you can go on
Heart.
naming. I can go on asking you to name.
Okay.
And these diseases like diabetes and hypertension
Eyes. Oh my God,
can
retinopathy.
practically
Yeah.
damage every organ out
Everything.
there.
Yeah.
It could be small, it could be big,
Yeah.
everything it affects.
Yeah.
So that's the extent it causes. Coming back to her question, what is the ideal HbA1c?
Yeah.
The ideal HbA1c, if not for non-diabetic, it is less than 5.6. But you're somewhere between 5.6 and 6.5. We call it as a pre-diabetes. Anything beyond 6.5, we do call it as diabetes. But again, that is to be taken with a pinch of salt, because HbA1c is not the only parameter, a gold standard to say this is diabetes. You need to back it up with your regular other sugar monitorings.
Sir, in home, how frequently should they do blood sugar monitoring? Like how we talked about ambulatory blood pressure monitoring. Is there anything like how many times
Yeah, we
a day?
do ask them to do something called self-monitoring of blood glucose.
Okay.
Nowadays, we also have patches for
Okay.
that.
Same
the
like how-
AGP.
okay.
This is a smaller patch.
Okay.
Which they can monitor, but I wouldn't suggest that for everyone.
Yeah. They
For
should
someone,
come to you, talk to you, and then take a
not
call
only
over.
that, yeah, correct. It has to be under guidance, but
Yeah.
also not every diabetic will need all these everyday routine testings and all that.
Okay.
That's for people who have high variability, who
Okay.
are more motivated to bring it down. For these kind of people, say
Okay.
for someone who's on insulin, they're going, you give a little more, they dip too much and they have low sugars.
Yeah.
Give a little less, they have high sugars.
Yeah.
Some certain group of patients, it's not for everyone.
Okay.
And routine daily testing is not
It's
for everyone.
Not for everyone.
It's
Okay.
a very specific subset.
Okay, so that has to be, the call has to be taken by the doctor.
it's a specific
So we
subset.
have one general awareness question.
Yeah.
Can you please explain about COVID vaccination and some health issues? Okay.
So I think it's a little vague,
Two
But-
vague and a vast thing to speak about.
but yeah, we all went through that pandemic of COVID.
Yeah.
All doctors strived through that period.
Yeah.
So on this day, I would say really hats off to all the doctors out there who stood by like
Definitely.
warriors
Yeah.
and took care of the entire country.
Yeah,
Oh.
definitely.
But one armament which we had was vaccination.
Yeah.
We can never say that there were a lot of doubts about it. Yes, it was very short period of time in which vaccinations were done,
Yeah.
but it did help in preventing the seriousness or in preventing transmission to others. It did help in a long way. There were instances where it told some type of vaccines had a little proneness to developing some clots.
Yes, sir.
So it is there, it did happen, but in a minuscule number of patients.
Okay.
I cannot say that it never happened,
Yeah.
but yes, overall if you see, you were in safe hands with the vaccination, and vaccinations are there to stay.
Yeah.
The biggest proof for that is today we are polio free.
Yeah.
So no one can say that no, it didn't work.
It does, definitely. We are very grateful of the vaccinations around us. Yeah. Sir, I would like to continue with the same thing, sir, we were talking about. Regarding diabetes, we were talking the organ involvement.
Yeah.
Yeah.
So it can practically involve every organ. So you need to keep checking. Sometimes it may appear that your sugars are apparently normal. So that's why we insist on these average sugars also. There are patients who are smart. They know that they have to go to the doctor.
Okay.
So
They'll
3
fast.
days, 4 days, they are in their best
Strict
behavior.
control, yeah.
So fasting sugars are good, postprandial sugars are good.
Okay.
But you do some organ damage testing, organ is damaged.
Yeah.
Now at the end of the day, the doctor has got nothing to lose with that.
Definitely.
It is the patient who's going to.
Yeah.
There was a big conference and they show which is the disease, they saw which is the disease which affects maximum as far as the financial thing is concerned. Forget about this burden. We'll take the call.
Hello.
Hello.
Good morning.
Good morning.
Yes.
I actually had a doubt.
Okay.
So my doubt is that, like, as we all know that nowadays we are going through a lot of stress and tension, and specifically for me as a student, I would say.
What's your
I'm
age,
facing
dear?
Quite a bit, like many weight loss issues.
Okay.
Like I gained a lot of weight at times during my exams and everything.
Okay.
And when I try to lose it, I somehow even end up getting some hormonal imbalances.
Okay.
Because I do a lot of intermittent fasting and I'll just not eat food at all and stuff.
Okay. Okay, so can you please tell me your age, dear? From where are you calling?
My age is 20 years old and I'm Shruti, speaking from Jaipur.
Okay, thank you so much for joining us. So some 20-year-old kid is calling, sir, asking for dietary advice and exam related stress.
So Shruti is, hello Shruti, good morning.
Hello sir, good morning.
You're still having exam, Shruti?
No sir, right now I'm on a vacation, like now my colleges are starting again.
Okay.
So that's nice to know that you're in a relaxed phase now. How do you feel now when you're relaxed, when you don't have your exams coming up, Shruti?
Sir, actually now is the time that I get stressed about my weight loss because it is all hormonal imbalances in Jaipur.
Okay.
And so the weather condition is also very extremely good.
Yeah.
So it gets too much at times, and then there's stress that if I gain weight, then there will be a lot of body image issues for me.
Okay.
So
yeah.
Shruti, by what small conversation we had, I think you're in this cycle, Shruti, vicious cycle, During exams, you're stressed about exams
Exams.
and marks and performance, and after exams, you're stressed about weight.
Wait. Yeah.
So,
Yes, sir.
Shruti, you need to break the cycle. Don't worry. Exams are there. Exams will come and go, and you will do well, like you've always been doing.
Yeah.
Don't worry about exams. Take it at one stride at a time. And as far as the weight goes, Shruti, I think at your age you will be super motivated to do exercises and good diet. I was talking about it a few minutes back.
Yeah.
It's not just about fasting. Please don't starve and fast yourself when you have your holidays, possibly at home. Instead, good, nutritious, low-calorie food which will help you in weight loss is the preferred choice, Shruti. I hope you will do that and also have your weight loss and not take too much stress about your exams.
Yes, sir. I'll try my best to do that.
Yeah, Jyoti.
Okay, very good. Okay, thank you so much for joining us today.
Welcome.
Okay, so there's one user, sir. The user has a question. Is there any medicine for diabetic patient that can also protect heart and kidney?
Oh yes, there are multiple medications
Okay.
like that. I don't think this is the forum where I
Forum where
should
we can discuss the medication.
name the medication.
Yeah.
But yes, I
There
will
are.
tell that there are specific medications which will help both diabetes, no, rather not both. It will help diabetes, it will help the heart, it will help the kidney,
Okay.
everything.
Okay.
But that also is not devoid of side effects. One has to be aware when to be given and what are the side effects. But definitely
There are medicines.
there are and validated excellent molecules which are there to treat all these things.
Okay, sir. Sir, although I'm a doctor, but I'm a kid at the heart also. We have grown up seeing a lot of people in the entertainment industry, especially. Like we have our favorite heroes and heroines. But recently, we have been seeing that in a very younger age, they are suffering from some cardiac illnesses. So I would like you to tell us about it because it is somewhere stressing us also. Like the people who are in the entertainment industry or a fitness industry, we usually idolize them. And now they are only getting some serious diseases. So what is it happening all about?
Two things to this, Aditi. One is, it is not that it was not happening before.
Okay.
It is just that now awareness is so much that one event happens and it's like, it's
Yeah.
there. It's there for everyone to see.
Okay.
So that is one thing. Whether
Okay.
if the question is, was it happening before or not? Yes, it was possibly happening
Okay.
at the same rate or even more. We don't know. But yes, it was happening. Second is, I mean, everyone associates entertainment industry with fitness industry and these things, which is true. They need to put up their
Looks
best
like
show.
that. Yeah.
Yeah, they need to put up their best show and all that. But at the same time, we also need to be aware that along with that, one needs to be careful about their habits.
Yeah, definitely.
So it's not just important that you eat and go and exercise while neglecting the other habits. One is not supposed to indulge in drugs
Okay.
of any sort. It could just be any sort of drugs, or it could be just nicotine, different sorts of tobacco, nicotine, smoking, alcohol. All these things have their own effects which will show up.
Yeah.
And there could be some genetic problems also.
Yeah.
At the end of the day, heart is a muscle.
Yeah.
Don't want to push that muscle too much also.
Yeah.
So there are genetic problems which you push too much, and the heart will just say, the muscle will say, hey boss, I'm done.
Enough for me. Yeah.
I'm done. So that is
Yeah.
the instance when someone's, it's not just the entertainment industry, we've had doctors,
Yeah.
cardiologists whom we have lost.
Yeah.
We're like, okay, all exercise, everything done. They come and then suddenly they drop down.
Yeah.
And then
That's
we
scary.
cannot be able to revive.
Yeah.
So it happens.
Yeah.
There are certain conditions.
Overexhaustion in any
So
way.
there's no point being scared or overly paranoid about these things.
Yeah.
But the bottom line statement is that live healthy.
Yeah.
Don't indulge in some addictive habits.
Yeah.
At the same time, don't overdo something.
Yeah.
The
Other
other
extreme is
spectrum
also very
also.
bad, definitely.
So good exercise which you feel comfortable,
Yeah.
and that should be
And
good.
when you need medications, please do take it. Don't avoid it.
The medications, please don't think that medications are some poison pill or something like that.
I
They're there.
have one quote about it, sir. Like patients know they'll eat everything possible, all desserts, Pepsi, Coke, whatnot, all the drugs possible. That time they'll never ask if it has any side effects. But when they come to the doctor, right into the OPD, they were like, "This medicine has some side effects." So I was like, "Please don't eat samosa and kachoris. We'll not give you."
No, it's natural. I
Yeah.
understand your end of it, and I understand the patient's end of it also.
Yeah.
They feel that that was more by choice. This is something which you have put it into me.
Oh right,
So you-
definitely. yeah, that matters. Sir.
So
Definitely.
that's how it is. But
Yeah.
let patients or people out there not think that medications are there and their only thing is. There are patients who ask me, diabetes, once I start taking medications, will I not get addicted to the tablet, doctor?
Okay.
That's the first thing.
Yeah.
And there are medications which will cause my kidney damage, doctor.
Yeah.
They're not understanding that you have a bigger illness, there is a bigger
Problem.
bomb sitting there,
Yeah.
and you're bothered about something
You're talking
else.
about knife. Yeah.
So
okay.
there's something called risk benefit.
Definitely.
Definitely, when your
Yeah.
benefit is much more, don't bother too much about the risk, and discuss about your risk with your specialist.
Yeah.
That these are the things you'll know, you'll be convinced that yes, this is better.
That is the whole life journey of a doctor, to understand where to give it and where not to give
Yes,
it.
it's
So
very
that's
important.
why, yeah, Doctors Day and doctors are really special for our public. Sir, I would like to ask you one more thing, sir. Like stroke per se, because I feel like, especially in elderly males or females, the early warning signs are mostly missed out. Even if we are well educated, even if there's a lot of awareness, but I myself have witnessed 2 to 3 cases where early signs of strokes were missed out, and when the patient was brought to the ER or emergency department, it was quite late, because there are some damages which are irreversible.
Correct.
Once the damage has happened, you cannot give back the health to the patient in the same state. And that's the misery, sir. If we cannot pick up at an early stage, then what's the use? So can you please tell some things about the early warning signs?
Yeah, so everyone knows what a stroke is in today's world, possibly in their own local languages, in different names. There could be lakwa hoditu, lakwa aitu, something like that, and all this. But what they don't realize is, if it's a stroke because of a...
Hello. Good morning.
Hello.
Good morning.
Good morning, doctor. Myself, Navya,
Yes.
calling from Bangalore.
Okay, Navya.
My age is 42.
Okay, tell us what happened, Navya.
Actually, like, my father is having diabetes.
Okay.
Actually, I have a BP and like low BP, high BP is in very risk. Can you suggest me how can I take care?
Okay.
Hello Navya, good morning.
Good morning.
So usually it's a combo which is not good for the patient's diabetes and hypertension.
Yeah.
But the good news of it is it can be perfectly well controlled, and they will have a fairly normal life if both the sugars and the diabetes, both the sugars and the hypertension are well controlled. If there are too much variations, then you definitely need to get back to your doctor for dosing it properly, and for any assistance of either medications or lifestyle, you're always welcome to visit, and we will help you out regarding that.
Yeah. So I think she got the answer, sir. You were telling about the early warning signs of stroke. I think after that we'll compile up the program, because we will never
We're running
stop.
out.
Yeah,
We're
we're
running out of
running
time.
short of time.
Yeah, only thing is stroke. Well, I'll just finish it by saying that when recognized early,
Yeah.
there is perfect adequate treatment, just like their heart attack we say, and how we can break open the clot, like
Yeah.
that for stroke also. For a clot, there is a small window period within which we can break it open,
Okay.
and they will have complete normal life after that without having any weakness left. So
Okay.
people have to identify that weakness in any part of their body. It need not be one half.
Okay.
It could be only one hand, one
Or
upper
just
limb,
deviation of the face.
or only the face, or
or
only the
some
legs.
slurred speech, some
Yes.
irrelevant talk.
So whenever it happens,
Yeah.
don't wait for the next day morning.
Yeah,
Go immediately.
Yeah.
Okay. Here, time is life.
definitely.
So you need to keep that in mind.
Yeah, definitely. So it was amazing, sir, to have this conversation. Although I really don't want to stop it, there's still so many questions and the viewers waiting. But we will like to compile the session for the day. And I'm really, really grateful and thankful for you to be very patient and listening to all of our queries and giving us your valuable insights. I would like to extend my heartfelt gratitude for all the viewers for joining us live, for putting forth all your questions, which has made this session very much interactive. And I would definitely like to extend my heartfelt gratitude towards everybody who has joined us today. Sarve bhavantu sukhine, sarve santu niramaya, sarve bhadrani pashyantu, ma kaschit dukh bhag bhavet. Let everyone be happy, peaceful, healthy, and out of the miseries. From the Vydehi Institute of Medical Sciences and Research Center, we wish you all a very happy Doctor's Day.
Sarve jana sukhino bhavantu.
Thank you all.